Welcome, everybody. Welcome to the show Center Presents. This is a menopause and midlife series, and what it's going to do is it's going to empower you with the knowledge you need in order to navigate your midlife health and beyond. I'm Dr. Heather Quayle, a women's health board-certified women's health nurse practitioner, gender practitioner, as well as advanced forensic nurse. I've been practicing for 25 years in the health and wellness space, in particular around women's health, and I am so thrilled to be with you through this series. This is something that I have created, and I'm super excited to have you on board to learn with me, and so that I can teach you all things around menopause and midlife health. This series is not direct medical advice. It's for educational purposes only, and it should not be considered medical advice, but it is part of my membership for my patients, and I wanted to create a course for more things so that you could have access to it beyond what I could give you in just our 1-hour visit. So this material belongs to my practice, the Show Center, the Sexual Health Optimization and Wellness Center, and you've been granted access to it as one of my patients. Please don't reproduce, cite, or do anything with it without explicit information. I have no disclosures. So in terms of the objectives of this program, we're going to learn about midlife and menopause transition, common symptoms, physiologic changes that are going on in your body. We're going to discuss some definitions and what happens during this time frame. We're going to improve the knowledge of evidence-based care around hormone and non-hormonal treatment options and for symptoms during the menopause transition. And it's also going to be used as a way to guide individuals to best interact with their healthcare providers. So if you've been given access to this because you bought this course and you're not a patient of mine, you can also have access to this so that you can go armed to your healthcare provider about how to make the best midlife and healthcare decisions for yourself. So what we are going to cover in this course is we're going to talk about getting to know your menopause. It's 11 different chapters. Your body in menopause, the Menopause Work-up and what's important, lifestyle pearls for menopause and midlife, hormone therapy, hormone and non-hormonal options, sexual health in menopause, menopause and weight, menopause and sleep, menopause and your mental health, menopause and your bone health, and how to talk to your provider about menopause and midlife care. To stay in touch with us, you can follow me at Dr. Quayle NP, or you can listen to my podcast, which is Just Ask. Here are some of my favorite resources that are out there. The Balanced app by Dr. Louise Newsome. You'll also see some downloadables that I have put in this course. You're Not Broken podcast by Dr. Kelly Casperson. Young Survival Coalition. Let's Talk Menopause. The Rosie app, which is wonderful for sexual health and menopause, as well as the International Society for the Study of Women's Sexual Health. I've also put together an extensive reading list that I do recommend as well during this midlife timeframe. Things such as Estrogen Matters, the Menopause Brain, the New Menopause by Dr. Mary Claire, Come As You Are by Emily Nagoski, and lots of different options that are out there for you. This presentation has been thoroughly researched and evaluated for accuracy. Clinical practice, as we know, is constantly changing, so new information becomes available every day, and we will continue to update this throughout the trajectory of how it will be offered to patients and for clinicians for download.